Hello, it's Dr. Rhonda Johnson. Today is Wednesday, March 22nd, 2023, and today I'm talking about long COVID. Well, the Washington Post reported on March 18th, I thought it was a quite good article on long COVID. Now, they have conducted their own research using data from Epic Systems, which is the nation's largest collection of electronic health records, and Kaiser Family Foundation. Now, that study looked at data from 4.9 million patients diagnosed with COVID from the start of the pandemic in early 2020 through January 2022. Now, I'm just highlighting some of their findings, and I'll link the article so that you can read it yourself. Now, long COVID symptoms were more prevalent in older adults and women. This was consistent across race and ethnicity. In their findings, they also noted that women consistently showed a greater likelihood of seeking medical care for long COVID symptoms. Long COVID symptoms were more frequent in people with pre-existing conditions and severe COVID cases, according to their findings. Now, their top 5 pre-existing conditions were obesity, lung disease, chronic kidney disease, cancer, and diabetes. They found that long COVID symptoms were less likely after Omicron COVID infection compared to the original and the Delta variant. They also found that people who were hospitalized with COVID are more likely to report long COVID symptoms than people who were not, and people who seek medical care for long COVID symptoms are more likely to be white, have higher income, and less likely to have Medicaid as a source of insurance. And again, please read the Washington Post article to get all the great details. Now, moving on, experts have said that recovery from long COVID varies widely. And again, it depends on your overall health, your initial COVID symptoms, and your nature of your illness. Now, I think the good news is that many people can and have recovered from long COVID. Now, I don't always share my personal journey, but I will say that I have recovered from many of the long COVID symptoms that I had. And I had fatigue and brain fog, really bad in particular. And I sort of committed myself to very gradually increasing my physical activity, getting enough sleep, stimulating my brain with left brain activities such as word games, reading books, doing puzzles, doing right brain activities such as listening to music of all sorts, and art therapy. Almost daily I would color. Now, I also intentionally meditated each day, and I engaged in a lot more nature-based activities. I got outdoors. I visited local parks, in particular parks that I had never been to. Now, I also took brain health supplements. They were kind of expensive, although I'm not going to say what I was taking, but they're supplements that I found on social media. Now, again, I sort of did this on my own, and I'm not recommending anybody do what I've done. I'm just sharing my little journey into my recovery from long COVID. It could be that I would have accomplished the same results had I done none of this stuff. Maybe it's just time. But I am fortunate that I was intentional, and it has paid off for me. And I don't suffer from brain fog, and my memory is pretty much, I'd say 97% back to what it used to be. So anyway, that's my journey, and I hope you'll look at that Washington Post article. Feel free to leave some comments about your journey and experience with long COVID. Again, it's something that's affecting millions of us post-COVID infection. Be well and have a great day, folks.